Hi everyone, Dr. David Kulla here. Got a great question here. So we have a patient that came in with hip pain, right? So this is an important video because a lot of you suffer from hip pain. Is it a hip misalignment? Is it a muscle issue? Is it a torn labrum in the hip? So I'm gonna go through a couple of warning signs just to help you guys out and help you figure out what is the cause of your hip pain. She's having hip pain when she brings her knee to her chest. The difference is when she brings her knee to her chest, if you bring your knee to your chest and you feel a pinching feeling in your hip, or if you move the leg out or in and you feel like a pinch, it could be two things. It could be a torn labrum, which is the cartilage that holds your leg bone in the hip socket, okay? And a lot of people have torn labrums and are just fine and don't ever have to get surgery. It just depends on how severe the torn labrum is because it goes 360 degrees around the joint. The other thing it could be is arthritis. She's young, it's not arthritis. She's a dancer, so a professional dancer. So if you want to learn professional dancing and you live in New York City, she allows me to, we will leave the description of their dance studio up in the Boogie Down Bronx, I believe, right? Queens. Oh, it's in Queens. Okay. I just like saying Boogie Down Bronx. Okay, so it's in Queens, and if you want to learn how to salsa dance from the pros, I'll leave that website if they're willing to give me that in our description. But going back to the hip issue, it could be arthritis if you're older than 50 years old, had a history of running or some other sport, you know, like we had a speed skater in here that would speed around in the same direction all the time, had hip arthritis on one side for obvious reasons. So we want to determine whether or not this is arthritis, torn labrum, or just a muscular issue causing the joint to either subluxate or not move properly, you know, not get its full range of motion. So all I do is come in here halfway between the ASIS and her belly button, and that is the way we release the psoas. This is the only way to release the psoas. So what we're doing is the psoas muscle, it's the only muscle that attaches the leg bone to the spine, which holds the leg bone in the socket. So yes, the labrum does too, but so does the psoas muscle. So if it's a range of motion issue or a subluxation of the hip, then you're thinking more on the lines of psoas or a hip or pelvic misalignment. And she, when I brought her knee to her chest, she didn't have the feeling of pinching, right? The pinching feeling is more, again, arthritis and torn labrum. She had a feeling where like she felt like it needed to pop, her hip needed to pop, or that when she brought it to her chest, that she didn't have the full range of motion. So right away I'm thinking, maybe this isn't a torn labrum. I hope it's not. And we're gonna go in here and release her psoas, and we'll be able to tell from her bringing her knee to her chest. Okay, go ahead and try that now and see if you just have more range of motion.
Yeah.
Fixed? Mm-hmm. So there you go. That's how you determine whether or not it's arthritis of the hip, torn labrum, or a musculoskeletal issue or a pelvic misalignment. And we adjusted her before this, her pelvis, just so you know. Thanks for tubing in. Thank you guys so much. If you got anything from this video, or even if you just like this view of the Empire State Building and the Chrysler Building, give me a like and don't forget to subscribe. Appreciate you guys.